Assalamualaikum. Hi, my name is Nurin Jazlin binti Muhammad Nordin. I am from part 3 of BA 235. Today I will talk and presenting about issue in electronic health record. So let's get started. Introduction to electronic health record. What is electronic health record? Electronic health record in nowadays state mostly known as integral part in modern healthcare system and were chosen since the implementation in the late 2000s passed through the Health Information Technology, which is HIT for Economic and Clinical Health Act in United States. EHR also involved the documentation of patients' record, retrieval, and prescription or for patients' medications, besides able to coordinate the care plans involving different healthcare providers and also electronic billing. However, there were some factors which have been hindered towards those application of the electronic health records that might be some issue in managing the system. Okay, next we are going to issue in electronic health record. There are 4 issues that I found. The first one is ethical issue. Second is system compatibility. The third is time consumption, and the fourth is about the funding. The first one is ethical issue. Uploading information can pose threat to the data security. This has raised the concern because of uploading the information from hard copies to electronic records, and the usage of computers and the database can pose a threat to data security as well as infringe on patients' privacy and confidentiality. Next, management of health data and information collected. The management of patient record and health data collected must be addressed prior to the implementation of the health informatics. Otherwise, this could lead to the data breach. As you can see from this picture, it's about time consumption issue. As the system itself might having some issue or technical problem, poor interoperability between the electronic health record systems can hinder other providers to communicate and access effectively. And exchange of information can occur also. So, the users and the functionality of each system used may be different from one to another. So, this can contribute to time consumption, slow processing, and not being user-friendly. Thus, also affect the physician and the patient themselves to have effective assessment. So, let's look at the next picture. It is about system compatibility. So, due to incompatibility of various systems, there is a need to develop a new system which can integrate the existing system. It is difficult to develop a new system, and neither it is possible to integrate various systems because this involves various locations and also different systems. The poor integration of images into the system of electronic health record can complicate the clinician of their workflow. So let's look at the next one is funding. Funds that were allocated by the government budget for health informatics is very kind of little, while the price of electronic health record is quite expensive. Thus, the support from healthcare professionals and managers on the development of the ICT is also lacking. If the EHR system is poorly designed or inappropriately used, the electronic health record related errors can occur, which this can endanger patient safety and at the same time reduce the quality of care. If there is any issue or problem, there must be a way to overcome. So, in order to overcome all these issues happen during the implementation of electronic health record, there are some suggestions. The patient's personal and medical information is definitely considered sensitive, private, and confidential, so it needs to be addressed prior to the implementation of the health informatics. Another way to overcome the issue regarding the privacy and confidential is to have electronic health record secured with an encrypted password. Next, the third one is, as we are managing the health system, it is very important to involve the healthcare professionals in the development of decision support system, and also to provide the salient information to the healthcare professional on the importance and the application of ICT in healthcare organization. Lastly, the conclusion is to conclude all the finding and research on the topic regarding the issue in electronic health record, EHR. It is very important to have proper and specific management in an organization, especially in hospital, to overcome any issue or problem, and in order to have a smooth and systematic structure of management. As a student of Bachelor in Administrative Health, myself, in my opinion, managing a hospital system also includes all the specific way of conducting, dealing, and learning with people and also a machine. So it is a need for management to have their attention regarding the issue or challenging that were faces nowadays on the uses of electronic health record in hospital. Thank you, madam, for watching. That's all from me. As you can see from the picture, these are some of my references and what I'm referring to while finishing this task given on the topic of the issue in electronic healthcare and patient safety in health system. That's all. Thank you.